I'm Dr. Tom Larkin, and welcome to the Larkin Protocol. What exactly is the Larkin Protocol? Well, the Larkin Protocol is the early detection and treatment of oral dysbiosis. So, my journey began in 1989 when I began to use a phase contrast microscope in my hygiene department under the direction of Dr. Paul Kais, who brought video microscopy to dentistry. And basically, my treatment at the time was for the periodontal disease and for the dental caries risk assessment. I really didn't have knowledge about the oral systemic connection. So, about 10 years ago, when this whole concept of the health of the mouth affecting the body, I began to revitalize and change with the goal of training as many individuals as I could in how to use this microscope. And so, the basis of the Larkin protocol are these four things. We test for the oral microbiome. We teach both the patients and the team members about the oral microbiome. We treat and then we repeat. So, central to this whole thing is the microscope. And I would not have been able to do this without the proper microscope. So, this is a Leica laboratory grade microscope. And most microscopes have the capability of four objectives, but I found the right person to help me custom design this because one of the things that I wanted was simplicity. I wanted to be able to do this virtually. It had to be simple. If I have four objectives on a microscope and a person is turning the wheel and saying, which one do I use? And this and that and the other. So there's one objective. We've made this very simple. The other thing we've done is we've taken away the eyepieces. Nothing is more intimidating than the eyepieces in a microscope. It's like looking in binoculars for the first time and you're trying to focus and trying to center. You don't have to do this. This plugs into a monitor and you can see the bacteria and then you go. So the test, teach, treat, and repeat looks like this. There's nothing that makes an impact more than the visual presentation of the oral microbiome. The patient immediately goes, what is that? And then you have them engaged. You don't have to talk about pockets. You don't have to talk about bone loss or anything like that. So one of the things I've done is to create a learning platform. This is a risk assessment model. So in the training, you learn what health looks like, what moderate risk looks like, and what high risk looks like. It's very straightforward. It's very thoughtful. And once again, the objective here is to be able to do this virtually. And then we come to the treatment side. So the treatment is essentially rinses, antimicrobial rinses. We're getting into the air polishing. Guided biofilm therapy is the EMS technique. Air polishing in general, there's several new things that have come along. Air polishing is a lovely, lovely technique for managing the oral microbiome. And then lasers. And so we're going to talk about lasers. So rinses, air polishing, and lasers are basically the recommended treatment protocols. Here in the States, I'm doing a lot of the biofilm DNA testing. So we're testing out the protocols before and after, and we share that. We have a very robust hygiene Facebook group called the Hygiene Hackers, and this group called the Larkin Private Client group. So I think it's designed from inception to be all-inclusive. Everything you want to make your shift to the wellness-based practice, which there's a tremendous amount of interest in today. It's turnkey, it's well thought off, it covers marketing, and also gives you the support on an ongoing basis. So thank you for your interest in the Larkin Protocol, and I look forward to meeting you.